Talking to your kids about mental health can feel overwhelming, but studies show opening up the dialogue can take a giant weight off their shoulders. We talk with Community Regional's Manager of Social Services to learn how to start those conversations.
Our ED social workers, on average, have daily interactions with patients dealing with mental health related emergencies. We have seen an increase in these psychiatric emergencies. Statistics that we have indicate that we've seen as much as 800 people a month.
These crisis emergencies can be anything from depression to feeling isolated from the COVID-19 pandemic. And if left untreated, these serious health conditions have professionals concerned as it relates to the growing suicide rates in the state.
One of the things that it did to our children, our younger population, was isolate them. And in normal child development, in their milestone development, that is really going against what we're trying to establish in early childhood.
Experts say that's why it's important for parents to open up barriers surrounding the conversation on mental health by talking about the disease itself.
As a parent, you are the closest ally to your child's upbringing, and so it is our responsibility as parents to attempt to do all we can to engage with them. It's a disease just like diabetes, just like cardiovascular disease, and you have to communicate with them openly about this, talk about it from the lens of the disease process. As our brain controls a lot of other physiological functions, so does it control our mental health.
For parents and caregivers, noticing signs of isolation, not communicating, mood changes, or sadness could be symptoms of poor mental health.
One recommendation or word of advice for parents is to not to minimize when your child or adolescent communicates with you. Children that we see in our emergency department, there's a lack of communication or the child doesn't feel understood.
That's why having information like resources to help navigate the conversation surrounding mental health and how to get help are crucial for family settings.
Looking for the resources in a moment of crisis isn't the best option. I believe that in order to help other people, you have to help yourself first. Understand what you're dealing with, and getting help as an adult is important.
Professionals urge parents to reach out to your pediatrician if you notice any changes in your child's mental health to focus on further crisis intervention. To access more resources for children's behavioral health and to learn more about starting the conversation surrounding mental health in your home, visit NAMI.org or the Fresno County website for local services available here in the Valley.